Hi again, Tosin. Welcome back to the platform once again.
Thank you, man. Thank you for having me. It's been a minute.
Yeah, yeah. Always a pleasure to have you here, man.
honestly,
Yes.
have been
So
good times, man.
yes, thanks all for always being willing to share, with us from a medical perspective, so many
Sure, man.
things.
Sure. What we
Yeah.
got,
So,
man?
so today we're going to be talking about something, the prostate, right?
Okay. Okay.
So what do you want us to know about the prostate as we age, especially
Hmm.
when we are 40 and above?
Sure. Okay.
Mhm.
I think the best way to start is the prostate is a male gland. Thankfully, it's not found in women, and it's located kind of around the male organ, just beneath the male organ and the bladder. Usually, I think from what we're saying, we'll get a picture for people to see. Essentially,
Yeah.
if you trace the male organ, the penis, up where it goes up, then the urethra, which is the pipe that you pass wee through, follows its way through into the bladder. So if you think of the bladder as an inverted balloon, just upside down, a balloon upside down with a tube
Yeah.
coming out of the balloon, the prostate sits at that nozzle mouth. If you tie a balloon and it's hanging
Yes.
upside down, the prostate is a gland that sits just right there. And part of its function, amongst other things, is during ejaculation in the men, it adds to the constituents of the semen in enriching it with nutrients and other constituents that help the sperm get to the egg, so they say. It has other functions as well in regulating some hormonal changes in men. So as you get to the age, I think once you are in your mid 20s, then some enlargement starts because clearly you've been using the prostate, you've been ejaculating, you've been doing stuff. So it enlarges gradually. There are hormonal changes that happen in men as well. But you get to the real crux of the matter is when you pass the age of 40 and above, the
Yeah.
prostate starts to get a bit bigger. So that's why once you've hit 40, you start hearing things like, oh, check your prostate, prostate cancer, prostate enlargement. One of the key terms people hear is benign, BPH for short, benign prostate hyperplasia. So that's when the prostate becomes enlarged. Yeah, so that's the prostate in a nutshell. Yeah, I think we'll stop there. We'll piggyback to other things as we go along, but that's the prostate in a nutshell.
Oh, excellent. So you just mentioned, so there is a benign enlargement, no harm, no foul, and there's
Yeah,
also a malignant, right?
yeah.
So can you shed more light now on things that cause these things, like in i.e. things that can cause the enlargement in the first place? Are these things preventable? Are there things that have to do with your diet, with exercise, with your
Mm.
lifestyle? You even hear things about people. Let's start one by one. Let's start with the diet lifestyle first. Then
Okay.
I'll ask you another question afterwards.
Okay. So I think the key things is as I think particularly it's particularly once you're in your mid 40s, early 50s, men start to get symptoms. The thing they find is that all of a sudden, mid 50s and 60s as well, you find out that you start waking up at night to pee. So you start getting that broken sleep. It's once at night, then down the line becomes two times. Then before you know it, you're waking up two, three times to pee at night. There could be other causes to that. It's not only the prostate that causes something similar. The people have
Yes.
separate issue, a segue called people that have type 2 diabetes can develop something similar. That's why
Yeah.
obviously you go to your doctor for a full assessment. But that's one characteristic. But coupled with that fact, men get something called frequency means that they are peeing a lot during the day. You pee now, you get back in next within the next hour, you get that urge that you need to go and pee again, and there's the urge to get to the toilet. Now, what I'm describing here are symptoms that go with prostate enlargement. So, in the group of prostate enlargement, you have the hyperplasia, which is the what we call when we say benign means it's not cancer, it's enlarged, but it's not a cancer, it's not harmful. Then obviously there's prostate cancer. Both can cause an enlargement of the prostate, and both can cause the same symptoms that we're talking about.
Okay.
One other symptoms we also mentioned so that men know is if you're getting that frequent urge, when you get to go and do the wee there, then it takes a while before you can initiate the wee. Usually before when you get there, you just boom, you do your thing, you're out. But sometimes men over the age of, usually in their mid 40s, above into their 50s, start finding that you are waiting there for a while before you initiate the stream. And even when you now initiate the stream, you find out that before, the stream used to be like a flowing tap, like you hear the flow hitting it well, like it is flowing, and it starts becoming more of a dribble. The strength in the stream also reduces. These are all common symptoms that go with prostate enlargement. I think for today, we'll try and start with the benign one, benign
Yeah.
hyperplasia, how we
Yeah.
call hyperplasia, and work
Yeah.
our way up. The enlargement of the prostate has been caused by a number of factors. Back in the days, we used to attribute it to testosterone, that oh, testosterone levels were high. And you probably will still find your doctors telling you that. And many people that have not changed their ways will tell you that it's testosterone. Well, the recent research we have, well, not we, but we've done research and it's out there that it's not necessarily just the testosterone that plays a role, other factors play a role in it. Now, just to segue quickly, in human beings, you are controlled by hormones. Hormones send signals to glands, and glands respond to hormones. So, hormones around the body are messenger cells. They go to a gland and they deliver a message. And basically, you have anabolic hormones and catabolic hormones. Anabolic hormones deal with growth, making things develop. Catabolic hormones deal with breakdown, energy consumption, burning energy essentially. So adrenaline, for example, will be a catabolic hormone. If you release a lot of adrenaline, your heart is going fast, you're burning energy quickly. Anabolic hormones are things like testosterone, estrogen, prolactin, and insulin. So it has been found multifactorially that one of the factors that people have not looked to this is actually insulin. Continuous high levels of insulin have been also found to attribute to enlarged prostates. And men over the particular age, because your insulin levels are constantly high, this comes about because people are usually eating very high carbohydrate diets. So we've segued into the lifestyle and nutrition now.
Yes.
So one of the common causes is the diet that we have. It's high in carbohydrates. And when you pass the age of 40, if you're not keeping up with other things in your lifestyle, nutrition, good sleep, exercise, for what I call the four pillars of health, um, you start losing testosterone. So remember when we went to the beginning, what I said was people used to think it was, oh, because of your testosterone as men, that's why your prostate used to be enlarged. But what we found more, it's more the testosterone to the estrogen ratio. As a man, you have a high testosterone to estrogen ratio. We tend to have more testosterone than estrogen.
Yeah.
But as we age, that testosterone level starts dropping, all coupled with the fact that we are more sedentary. We sit down, we drive to work, we spend hours in traffic, you sit down in AC, you eat food, you get home, you sit in front of and watch channels and NTA news. You don't do anything, you eat food there again, you sleep, nothing else. So you have become very sedentary. So because of that drop, things have spiked up. Your body composition changes, you get more in hyperinsulinemia because you have eaten carbohydrate food. Your glucose level has spiked, and if your glucose spikes, insulin is now released to come and take care of your glucose. But it doesn't only take care of glucose because it's released, it affects all the glands in the body. The prostate has receptors called IGF receptors, and they do is when the insulin is there, it triggers the receptors and they start growing. It just starts some development, and that development increases the cells and the amount of it. And so it's a combination of high insulin, a poor estrogen to what do you call it, estrogen to testosterone ratio
Testosterone ratio.
where the estrogen level is almost catching up with the testosterone ratio. And what do you call it? Other anabolic hormones like prolactin, for instance. We can always discuss that another time. But those combined factors can contribute to an enlarged prostate. So coming back to what we talked about, how can we help ourselves with this? In everything I've said so far, one of the key things that we have to look at again is diet. Is an enlarged prostate preventable? To a large extent, yes, it can be prevented. There are other factors that may be out of our control, which is just the fact that you age, but you can reduce the risk or tendency of you developing it in the future. Or if you have, and you're listening, you have an enlarged prostate, there are things you can do that can start helping you reverse or start shrinking that enlargement in the prostate. The caveat I tell people, anybody listening, is that this prostate that is enlarged that we're talking about has been enlarged over a gradual process of many years. So do not expect to do the things we are talking about and see a change in 3 months. You do it and like, oh, Dr. Tosin said this is going to work and it hasn't worked. No, unfortunately, the gradual way it increased is the gradual way it's going to reduce. The only fast way, if you want to sort it out, what do you call it, medical or surgical interventions, of which there are many out there. So I'll pause there, and we can piggyback back from that later.
That was very, very enlightening, actually. And that also means that for those of you that are younger now who are hearing this, you can, key into this now and, just have your lifestyle adjusted earlier so that you could actually, begin to benefit from this knowledge earlier rather than being the one trying to solve the problem. You're actually preventing it,
Mm.
right? So, well, does this have anything to do with your sexual activity as well? Can your lack thereof or your volume of sexual activity have any relation with your prostate health or prostate size?
Prostate enlargement. It initially that was one of the thoughts, but I think that has been disproved. There are in thing about medicine, there are studies that tell you yes, and there are studies that tell you no.
Yeah.
So right now, the story is that, well, the general medical thinking is that there is no correlation, direct relation between increased sexual activity or decreased sexual activity and an enlarged prostate. And we are focusing more now the lifestyle changes that we are getting there. So it's more the fact that there are innate hormones that are sending messages to the prostate. Because think about it, the sexual activity that most people have is a short period of time in a day. And
Yeah.
whatever happens there, it happens for that short period, things go back to normal. But when your hormones are released, things like insulin and estrogen or testosterone, there's a peak and the plateau, so they stay released for a longer period in your day, and it's something that is sustained. Unless there are some heavy, highly sexual men out there that have sex every day, I don't see how the prostate can get enlarged. But you eat every day. Well, most people do anyway. So your insulin is spiked every day. You see what I mean? So there's a
Yes.
constant spike. So there's a constant stimulus. There's a constant spike. There's a constant stimulus. So those are factors that have more, what do you call it, effect on the prostate itself. There are multiple factors affecting the prostate. What we're learning is not just one thing. So we can't
Yes.
expect that people will do one thing and fix it. And sexual activity, again, like we talked about, is a finite amount of time.
Yes.
Unless there are people that feel they're having sustained sexual activity for 4 to 5 hours a day, well, what do you call it? I'll delve my cap to them if they are doing that on a daily basis. Because where we go back, it's a finite amount of time. You release hormones during the sexual activity, and they go back to normal. So
Yeah.
there's a sustained effect. It goes back to normal. On the other side, the foods that we are eating every day. You are eating breakfast, lunch, dinner, depending on the average human being. And so each time you are doing that, you're having a so-called balanced diet. So you're having carbohydrates on the diet there. So you're getting a lot of sugar intake, because all carbs, well, most carbs are eventually converted to either sucrose, to glucose, or fructose, and they both stimulate the insulin pathway. So once that insulin is spiked, there's a sustained spike in the insulin. It works on your glucose, then it keeps the level in the body, because as you are functioning, it's breaking down, packing glucose into places. So that constant daily release and effect has more of the effect on that. So I
Yeah.
think, going back into how to help the prostate, one thing I'll probably look into for people will be, can they look into what they are eating?
Yeah.
as a starting point. Let's start with what not to do. One of the recommendations, and to be very fair, it's a general recommendation. It doesn't work. Everybody is unique. It may not work in everybody, but the general recommendation is trying to reduce the amount of carbohydrate on your plate. Everybody has heard of the keto diet. The keto diet is out there. I may not personally say, okay, go on a keto diet. Although if you do for a good period of time, that is helpful. I practice in between everything, and you try and get as much help with the keto diet as well, or going on a low carb diet. The outcome is the same. You're trying to reduce the amount of carbohydrates. If you reduce the amount of carbohydrate, you reduce the insulin spike in your body. You reduce the insulin spike in your body, the signaling of the prostate by with the IGF-1 receptor is reduced. That's one pathway to help.
Yeah.
Now, there are other things that you can do to avoid that. You avoid things like soy-based foods, soya beans, and all
I
that.
was going to ask that, right? That is things that are rich in estrogen now, right?
Exactly, estrogen-based foods. Because
Yes.
as you age, if you increase estrogen, you go through male men go through what we call estrogen aromatization. So you see
Yeah.
the classic quote unquote man that has arrived mid 40s, big belly, a bit chesty, quote unquote, almost like breast, fat neck.
Yes.
So
Yes.
what they don't realize is their body's undergoing a bit of estrogen aromatization, and you are gathering a lot of estrogen. That in itself triggers a lot of enlargement, not only in the prostate, but in other organs, causes a lot of problems in other places there, which we'll obviously discuss later. That's another issue there. And other things to try and avoid are foods that may also trigger the whole insulin pathway. Grains, for instance, grains are good, but you have to modulate what you're getting and not make it too much, because it's still the same thing we're getting to. Everything is
Yeah.
eventually broken down to glucose in the body.
Yes.
Yeah, so those are things to avoid. Then I think we'll get into what we may suggest you do food wise, things you can try, things that have shown some benefits as well, and we can talk about that.
So, for instance, if you go to Chinese restaurants a lot,
Yeah,
they have a lot of soy-based meals and sauces, right?
yeah,
So one has to be very careful, right? If you
yeah,
are someone that frequents the Chinese restaurant a lot, always look at the menu and try and avoid soy, 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 right?
yeah,
So that you don't get that into your system
yeah. I
at
mean,
higher doses.
it's that's one of the things, and obviously, yes. So if you go out, if you are going once a time to Chinese, you can have that one meal. But
Yes.
if it's people, like some people have gone off dairy, and they are doing complete what's that thing called again, alternative milk, and they are drinking soya milk, for instance. So
Yeah.
that is one of the concerns we have with that.
Yeah.
Mhm.
So apart from soy, which other thing is, because soy is kind of like up there, which
Yeah.
other thing is common, especially for those of us in Nigeria, that could spike estrogen?
Do you know, off the top of my head, I've not actually thought of that. I'm not 100% sure. I have to check up on that in on Nigerian foods. I'm not actually. I've not looked into that. Do you have any? Do you have any? Do you have any ideas of anything that have been mentioned?
I actually don't. I just wanted to know if there was any, but I know that soy is what I've read about all the time. That soy, 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 estrogen, soy, estrogen, soy, estrogen. So
I mean, I'd like if anybody listening, if they have it, they can put it in the comments to let us know. That's a question I want to put for to one of my nutritionists colleagues and friends, because
okay,
most times when you think estrogen foods, it goes to soy and or soy based products that come to
yeah,
mind.
yeah.
Um, that's the thing that come to mind quickly, but I'll probably need to take a note on that, and maybe drop a comment if I get any, for people to check up on the comments
Okay,
as well.
excellent. So guys, please put in the comments if you have any ideas in this regard, right?
Mhm.
So that we look at this. But like from what we know now, as you grow older, you want to minimize your soy intake. Then exercise.
Yeah.
Exercise. How does exercise help balance your hormones in this regard? How will it help you? Like now, we talked about your carb reduction.
Yeah.
So from a diet perspective,
Yeah.
so how does exercise come to play in this regard too, in helping balance your hormonal
Okay.
flow?
I mean, it's a good thing, especially with hormonal balance. Like,
Yes.
Regular exercising helps boost testosterone levels. So if you have an increased testosterone to estrogen levels, there's a better balance there. I think people still talk about DHT, the strong binding testosterone being high, being an issue. It's what do you call it? It's debatable. But when you exercise, one, you boost your testosterone, which helps the production in the body to help your metabolism, and you put on more muscle. When you increase muscle on your body, that means your glucose uptake is better. Now, notwithstanding, everybody, once you put glucose in the body, everybody knows that it's insulin that clears the glucose. But interestingly, that's actually been discovered that there is a separate pathway in the muscles that helps glucose uptake independent of insulin. That's why it's interesting that you see men that are built and muscular, they can burn a lot of carbohydrates quickly. You see them eating a lot of carbs and they can go through it quickly. I mean, it doesn't mean that they are not spiking their glucose and insulin. They probably are, but it's one their extra muscle gives them the extra quote unquote padding to be able to catabolize and go through the glucose faster. So that's one advantage. When you exercise, you sleep better. When you sleep better at nighttime,
Yeah.
that's where you get a lot of regulation of the hormonal pathways. Things like cortisol regulation. Cortisol regulation in itself, once you're able to get that regulated properly, helps with the reduction in your glucose spikes during the day and helps with the production of testosterone in men as we age as well, interestingly. And once those two can be regulated, obviously the cascade goes on to help with the signaling and reduction of the signaling around the prostate gland itself. So it's a bit of a long-winded. There might not be a direct link between exercise and prostate reverse enlargement reversal, but it's all those little factors that can come into place to help.
Yes. And just like in your recent YouTube short where you were talking about the importance of doing strength training, right?
Ah, yes.
So when we're talking about exercise now, we are talking about much more than just like jogging or taking a walk, which is what a lot of people in the 40s and 50s do. There's an important need to actually incorporate strength training,
Hmm.
as you
Hmm.
grow older. And these are some of the reasons, especially for testosterone for men. And this will also help in your sexual, your sexual abilities too. Testosterone boosting will help you in that regard. So,
Improves your libido, improves the
yes,
libido over the age
yes,
of, because a lot of men don't want to admit it, but over the age of 45, the libido drops. Men will tell you, "Oh, we are still performing," but I'm a medical doctor. If I see
yes,
it in clinic, as a man, they don't like to discuss it. But once there's some characteristics that come forward and you pose the question, you kind of
yes,
find out that their libido has dropped. And
yes,
not it's not necessarily stamina and performance. That obviously can play a role because that's more a cardiovascular question on another side that we
yes,
can discuss. It's more the fact of maintaining good erections, getting the
yes,
erection in the first place, and having
yes.
satisfied sexual intercourse. That all plays into the role of men exercising because, like you said, it's more about doing the basic things are good. You're walking, and what's the other thing you mentioned again?
Jogging, right?
Jogging.
Walking, jogging, yes. Those are all like cardio.
If you do jogging, you are building your cardio. You are doing your get. If you can get good zone two exercises, good for cardiovascular
Health.
exercise health. But putting on muscle, keeping your muscle mass is one of the key indicators that we found for longevity. One of the problems when we did research on people over the ages of 75 and 80 was the loss of muscle mass, especially in their thighs, difficulty getting up from a chair position or getting up from the floor. Those are issues there. So I mean, that's a full load. That's a full YouTube video on its own that we can have at some time. But yeah, that's something I'm quite interested in as well. But yeah, let's
Yes, you can talk about that
come
next.
back to our prostate. So we'll see how we can go
Yes,
with that one.
yes. I think that sounds very interesting because, like you said, the thighs,
Hmm.
the leg muscles are very hard to develop. But anyway, let's not jump the gun. We'll do a video about that. So you guys just stay tuned. We'll do
Yeah,
another video talking about that and how that's important and what you can do to ensure that you help yourself before it's too late. So I think we've covered enough for today concerning the prostate itself. So if you
yeah.
guys have any questions more
Yeah.
direct that you need.
I think before we finish, just to drop
Okay,
some now,
yeah,
um, I think they've talked about groups of foods that people can have that can help with the prostate. So there are the things we've talked about going on a low carb diet, but there are some
yes,
other extra things that people have been shown to help. Now, there's been a research on something called lycopenes. Lycopenes is a pigment in foods that have been shown to help reverse prostate enlargement. Apparently, I can't remember the exact enzyme, but it inhibits a particular pathway in the enlargement of the prostate gland. I think that's it. But off the top of my head, they're called lycopenes. Lycopene is a pigment that is found in some particular foods. The commonest ones are tomatoes. So the red pigmentation of tomatoes, grapefruits that are red, and what do you call it? What's that third one? There's one that came to mind. I can't remember. Watermelons. That's the third thing. So,
okay, cool,
so those particular things, lycopene containing fruits, can help. Now, there's been interesting research into beetroots, and it's not the science has not been 100% validated. Some research has been done into it, but it's been shown that consumption of beetroots, a daily amount to a certain extent, may help reduce the enlargement of the prostate or help with prostate enlargement or things like prostate cancer. But still, it's not 100% validated. But as science is, nothing doesn't necessarily need to be 100% validated. Are beetroot
yeah,
fruits good? Yes. So please add it to your meal.
yeah,
Then you also have nuts. Nuts contain a lot of zinc. Zinc plays an interesting role in the pathway in the prostate as well. So nuts like cashew containing nuts, pistachios, and Brazil nuts. Those are three common ones that have been mentioned. And going with things like high what's that thing called, omega-3 oil, so high levels of omega-3 oil, omega-3 fish oil. Commonest one everybody knows is salmon, so we always talk about wild caught salmon, but a lot of fish in Nigeria also contains good amount of that. So
like
and
sardines and sardines,
sardines, I think mackerels can be
yeah,
good.
mackerel. So yeah,
It's also how
yeah,
how they process. So
and they are cheap, yeah,
exactly. The caveat with sardines is that make sure you're eating it well, not too much, because sardines can have high levels of mercury, which is another,
material.
getting that balance right. And I think those are the ones on top of my head. Anything I remember, I'll put in the comments as well for you. So the way I tell people it is simple. So everything I've given here, the fruits, all you need to do is mash them together and make it into a smoothie, and bam, you've got your prostate shake in your hand.
Or salad, like me, I do a lot of beetroots in my salad,
Your salad, exactly.
And these beetroots are also very good for, boosting your energy.
Yes.
Apparently, nitric
It boosts
oxide.
energy. Exactly. Exactly.
Yes,
So they have a lot of nitric oxide as well, which helps
yes,
boost blood flow, especially when it comes to strength training as well, which is one of
yes.
the things.
Then you leave the rest to God. Do your part.
Yeah, yes, sir. Yes, sir. Most definitely. Most
Oh
definitely.
my goodness. So Tosin, thank you so much once again for this enlightening episode.
Thank you
Um,
for me. I hope it was
everybody,
useful to people. And
yes,
yeah, leave your comment. Let us know, and especially
yes.
that thing we talked about. Question to the audience: what are the examples of high estrogen containing foods you know in Nigeria? Leave your comments below.
Please do. Then subscribe to the channels. So mine is 40 feet on phone. Dr. Tosin is simply Dr. Tosin. Very easy to find on YouTube.
Yeah,
And ask questions. We will definitely answer. And we're trying to just enlighten people and help people stay as fit as possible as they grow. Once again, Tosin, thank you so much for being on the show.
yeah.
Look forward
Thank
to
you
the
so
next
much
one.
for having me, man. Thank you.
Have a lovely one, my bro.
Cheers.
Bye, everyone.